Okay, I think we're going to get started now. We've got a number of people online already. Hello, everyone, and welcome to the Fall Pharmacy Forum presented by the Canadian Foundation for Pharmacy. The topic for today's forum is Destination Pharmacy. We will be exploring innovative pharmacy practices that highlights pharmacy as a destination in primary care. I am Linda Bertula, the Executive Director for the Canadian Foundation for Pharmacy. The foundation began in 1945. It is Canada's only registered national charity for the pharmacy and in its mission, in 6 words, it is to help advance the profession of pharmacy. We do that by raising funds for grants and awards that our board of directors bestow to deserving researchers, innovators, and leaders in pharmacy. Through our Innovation Fund, for example, we have granted more than $2 million for 40 research projects, many of which help prove the value of pharmacy services under expanded scope of practice. And today's presentations are a good example of some of the fruits of the the foundation's research. We also have the Wellspring Leadership Award, which provides pharmacists up to $10,000 a year for financial aid for fostering personal development and leadership. CFP also helps advance the profession through educational content such as today's Pharmacy Forum, our Pharmacy Management in Canada textbook, and the online course, which is an invaluable resource for pharmacy students and pharmacy owners. We could not do this without donations from individuals and the support of our corporate partners. If you're not already a donor, I would ask each one of you here today to consider adding CFP to your personal list of charities. It's an easy, effective way to give back to your profession. And I'd like to take a moment now to thank today's sponsors. Our platinum sponsors are Amgen, GSK, Shoppers Drug Mart Loblaws. Our gold sponsors are, oops, lost my page, Pfizer, AstraZeneca, and AbbVie. Before we get started, I just wanted to let you know that today's session is being recorded and will be available on our website after the presentation. Also, if you have any questions, please put them in the Q&A section and we will make sure that they are addressed. Our webinar today is focusing on 3 pharmacists that are making a stamp on primary care. You will hear all about their practices and the difference they're making in their communities. The format for today is that each pharmacist will make a presentation followed by a panel discussion. We're extremely lucky today to have Angeline Ning as our moderator. Angeline is a pharmacist and Vice President of Professional Affairs at the Ontario Pharmacists Association, where she's responsible for helping advocate for and advance the profession by leveraging unique expertise of pharmacy professionals and enabling them to practice to their fullest potential. Through her career, Angeline has worked in a variety of different pharmacy settings, including community pharmacy, long-term care, and the pharmaceutical industry, as well as teaching. Over to you, Angeline. Thank you.
Thanks, Linda, and thank you to the CFP for hosting this forum. I think it's such a timely topic with the profession continuing to evolve so quickly, and being able to learn from each other across the country is so invaluable. So with that, I'm excited to introduce our first presenter of the day, Caitlin D'Entremont. Caitlin is a pharmacist and pharmacy manager at City Drugstore in Yarmouth, Nova Scotia. Her pharmacy was one of the initial 12 pharmacies in Nova Scotia to adopt a government-funded community pharmacy primary care clinic in 2023. These clinics have allowed herself and other Nova Scotia pharmacists to move to appointment-based pharmacy and improve patient care by utilizing their full scope of practice, including ordering blood work, providing chronic disease management, and diagnosing minor ailments, hypertension, and diabetes. So please join me in welcoming Caitlin. We're looking forward to hearing your presentation.
Hi, everybody. Thanks for having me today. I'm just going to start sharing my screen. And if somebody is able to let me know if that's working for everybody.
Caitlin, we can see your slides, but
Not me.
I don't think you're in presenter view.
Mm, I think. Can somebody see? Can you see me now?
It's okay. We can see it.
Okay, we're good. Okay. Um, so again, thanks for having me. I've worked in rural community pharmacy since I've graduated. I've always been very passionate about community pharmacy and the role pharmacists play in primary care. Being known as one of the most accessible healthcare professionals was one of the reasons I was so drawn to pharmacy in the first place. So again, in 2022, the Pharmacy Association of Nova Scotia, or PANS, as I'll be referring to them as for the rest of the presentation, they asked managers of pharmacies in Nova Scotia if they would be interested in this project, Community Pharmacy Primary Care Clinics, or as we like to say quickly, CPPCC clinics. They wanted to test a system where pharmacists could apply their full range of training, knowledge, and skills. I couldn't think of a better way to support our community, many of which are struggling with the lack of primary care providers. So our team quickly got on board. I should mention also that some of the information in these slides was pulled from our PANS marketing tools just to ensure that the information I shared today was accurate. So this government-funded pilot project began in 2023 with 12 pharmacies, which has now grown to roughly 45 pharmacies across Nova Scotia. The goal of the project was to move from on-demand pharmacy services to appointment-based pharmacy services, improve patient care and access to care at a larger scale in the pharmacy, establish a more predictable workload that aligns with staffing, and decrease work-related stress. The pilot project provided funding to support a full-time pharmacist position and a full-time clinic administrative assistant. A pharmacy clinic administrative assistant was hired in our pharmacy to support clinic activities, as well as project documentation, ensuring that the pharmacists were able to maximize their patient appointment time. Our administrator is absolutely vital to our team. She handles our bookings, cancellations, billing, phone calls, and over time has learned many of the appropriate triage questions to ensure that when patients come to our appointments, their health needs fall within our scope of practice. I don't want to spend too much time on this slide because I think there are many provinces that are expanding to a similar scope of services provided by pharmacists. But here I have listed the different types of services pharmacists in Nova Scotia and our community primary care clinics can provide. They're all completed fairly regularly within our clinic, but I just wanted to highlight a few that I think have made a large impact in our community. Chronic disease management with heart disease, lung conditions, and diabetes has been a great addition to our practice. Here we focus on appropriate medication management, health goals such as diet, exercise, and smoking cessation, and help our patients reach their health goals like blood pressure, A1C, and LDL targets. We can adapt, substitute, and initiate medication therapies in these appointments. We provide initial consultations and multiple follow-ups for monitoring labs and ensuring targets are being met. Strep throat assessments, group A strep throat assessments, ear and sinus assessments with the ability to diagnose and treat. We do refer children under the age of 3, but especially this time of year, we see many young families and all are incredibly thankful that they did not need to wait in the ED emergency department for hours and could be seen usually within 24 hours and many within the same day. Lyme disease prevention and early localized Lyme disease treatment. Pharmacists in Nova Scotia have been able to provide chemoprophylaxis for tick bites for a few years now, but this summer our scope was expanded to treat early localized Lyme disease. Nova Scotia actually has the highest incidence of Lyme disease per 100,000 people in the country. The ability to provide this service has been incredibly well received by our patients. The presentation of Lyme does need to include erythromigrans. We don't order a lab confirmation of Lyme disease or blood work to confirm diagnosis. So it does have some limitations, but I am sure we have kept many out of the emergency department by providing this service. Diagnosing diabetes and hypertension. Personally, I've really enjoyed this recent expansion in scope. We see many patients for prescription renewals who haven't had a family doctor in many years and haven't had anyone screen them for diabetes or hypertension during that time. Being able to screen for these conditions has allowed our team to really feel like primary care providers and offer a more well-rounded form of care for our patients. Many of the services listed here can be provided by pharmacists outside of the CPPCC clinics, some of which are funded, others are not. Within CPPCC, there's further funding models for our patients at this time, and they can leave our appointments without paying a cent. At this time, chronic disease management, strep throat assessments, ear and sinus infections, diagnosing diabetes and hypertension are services provided solely by the CPPCC clinics. So pharmacists ordering lab tests was enabled by scope of practice in 2013 in Nova Scotia. It was only in 2023 did pharmacists become added as providers to the Nova Scotia Health Lab system. This ability to order labs allows us to determine the appropriateness of therapy for prescription renewals, therapeutic substitutions, prescribing within an initial diagnosis, and most recently, given us the ability to diagnose diabetes and hypertension. We also provide point of care testing. This point of care testing gives us access to information in about 5 to 10 minutes. So we're completing Group A strep tests to confirm suspected cases of strep. We're assessing lipid panels and A1C during chronic disease management and prescription renewals to determine appropriateness of therapy, the need for adaptations or substitutions, and guide therapeutic choices. On this slide, I've just included a few pictures. Our pharmacy did undergo renovations prior to the initiation of this project. It had been on the vision board of my owner, Matthew Malte, and turned out to be great timing. It was a good push to get the renovations completed to align with the clinic opening. The picture you see on the left was a vision of what our pharmacy was going to look like, and it does very closely resemble that today. On the right, you'll see a few photos of our clinic room. So our clinic has a fridge, sink, exam table, and our point of care testing equipment, blood pressure machines, otoscopes, and scale. We also have a small fridge dedicated to our public health vaccines. Behind the scenes, I wrote some of our technology that we were using and kind of expanded over to. I would say that most of the team has enjoyed switching or using other systems now that we're over the hump of learning it. So MedAccess we use most often for documentation and charting. We are able to review labs that we've ordered in the clinic, create prescriptions, fax communications between pharmacies and other healthcare professionals, as well as manage our bookings through MedAccess. We do appointments in person, by phone, and have the ability to provide virtual care, but we've not found that to be a very popular option, and not many of us have done that. We still use Kroll for billing our services and documentation when the patients in our clinic are also patients of our dispensary. We use Share to view relevant lab history for our patients. Share is connected to all Nova Scotians' laboratory results, their ECGs, imaging, and clinic reports from other physicians. So we do have access to Share and use that quite frequently. Recently, we did start working with 4 nurse practitioners specifically hired to work with our CPPCC clinics. With them, we discuss complex patients, ask for advice, and decide together which patients require ECG testing, which the nurse practitioners can order. We use Virtual Hallway for these appointments. Our pharmacy team also switched to paperless workflow during the renovation. I feel like this has definitely improved our workflow and efficiency in the dispensary. We did notice a bit of an increase in the workload in our dispensary. Our clinic doesn't require any patient to be part of our pharmacy to provide care. We work well with other local pharmacies and make every patient aware that we can send any written scripts to their usual pharmacy. Some patients have transferred due to ease of having their care and prescriptions being provided in the same location, but it is difficult to say if this increased workload has been solely due to the clinic. There has been other changes in the community like pharmacy closures, which can impact those numbers as well. From a pharmacist standpoint, this change to appointment-based pharmacy has been a welcome challenge. The expanded scope and involvement in patient care has increased my job satisfaction and keeps the day-to-day engaging, challenging, and interesting. The clinic has taken much of the workload stress from dispensing pharmacists. Being able to provide same or next day appointments for the patient has alleviated the stress of finding time to complete these assessments during a busy dispensary shift. Most patients are understanding and our schedule is usually quite accommodating. We leave appointments open each day from 4 to 5 p.m. for immediate needs and can see most patients for prescription renewals within 2 to 3 days. And I just kind of want to close up with this last slide here. Many of our patients have been without a family physician for many years, and they are completely exhausted by the healthcare system. The comments we receive from the majority of our patients are incredibly positive. I wrote a few things that patients have said to me over the past few months. I'm not sure what I've done without the clinic. I feel as though someone is truly taking care of my health. And the one that I probably hear the most is, we're so thankful that you're here. The pilot project was intended to run for 1 year. That year was finished in February 2024. The government extended the pilot project, and we are still running today as a pilot project. Discussions are ongoing for a permanent funding model. I can only hope that those discussions are positive, because the clinics are proving themselves to be successful. I wanted to share a little tidbit clip from the Canadian Pharmacy Association article written in June 2024. The closing paragraph is on the slide there. The Nova Scotia report is clear: empowering pharmacists to play a more active role in healthcare benefits the entire system. The nearly 10% reduction in emergency room visits for non-urgent or less urgent cases is just one of the many advantages of integrating pharmacists into primary care. By expanding the role of pharmacists, providing necessary resources, and increasing public awareness, Canada can create a more efficient, accessible, and patient-centered healthcare system. I'm certainly not surprised that by that article having been a part of these clinics. Our days are full. We average well over 20 patient appointments per day, and I'm excited for what the future holds for pharmacists, not just in Nova Scotia. And I hope that we continue to receive support from the government and our fellow healthcare teams. And I just wanted to thank you for having me here today. It's been a pleasure.
Thank you so much, Caitlin. I think Nova Scotia has been such a trailblazer with their primary care clinics. I know many provinces, including Ontario, where I'm located, have been following along with keen interest your success story, which I think you really highlighted on that last slide. So thank you so much for sharing your experiences with us.
I'm happy to.
Thank you. Our next presenter is Roland Wiseman. Roland is a full-time clinical pharmacist for Rexall, where he has worked since graduating from the University of Toronto, first as a staff pharmacist for Rexall's mail order pharmacy, Rexall Direct, before switching to the exciting position of clinical pharmacist in 2024. In this position, Roland piloted the launch of Rexall's first ever pharmacist-led walk-in clinic in Barrie, Ontario, their first in the province, and he's now currently running Rexall's fourth Ontario clinic in Vaughan. So welcome, Roland.
Thank you, Angeline. Thank you, everyone, for joining in. Just wanted to confirm that my slides are up and running and you can see and hear me well.
Oh, perfect. Thanks, Roland.
Awesome. I'll go ahead and get started then. So as Angeline introduced me, my name is Roland. I'm the clinical pharmacist, one of the clinical pharmacists working for Rexall, and I'm excited today to share how our pharmacist-led walk-in clinics are making a difference to patients and their health outcomes. I'll begin with a little background about myself and the clinics, and then leading up to our impact and future ambitions. So to start about myself, Angeline did cover a good portion, but I'll just delve a little bit more. So I'm a relatively recent grad from the U of T Faculty of Pharmacy, with most of my experience being in the community pharmacy sector. I joined Rexall shortly after graduating, working at their mail order pharmacy for about 1.5 years, and then I switched gears to lead the launch of Rexall's first pharmacist-led walk-in clinic in Ontario. Recently, I've relocated to launch and lead the company's fourth Ontario walk-in clinic in my hometown of Thornhill in the city of Vaughan. So what is a pharmacist-led walk-in clinic? It's a question I get a lot, especially from patients who learn about such a thing when they come into the drugstore or search online for clinics near their location. And while there are many ways to answer this, perhaps the best way is through a visual experience of how our clinics operate. So here's a wonderful collage that our team put together of what we call our pharmacist care walk-in clinics, highlighting the various signs, spaces, and services that come installed with the launch of every clinic. As you browse around through all the images, you'll notice things like our spacious check-in and waiting areas that integrate seamlessly with the renovated dispensaries, promotional adverts featuring the leading clinical pharmacist unique to each drugstore, newly furnished assessment and care rooms fully equipped with professional-grade point-of-care testing devices, and kiosk stations that help patients connect to our telemedicine partners in a seamless, user-friendly fashion. The design that goes through each of these clinics are meant to invite patients to a comfortable setting, allowing the pharmacist to provide them a personalized white glove service and practicing at the fullest scope available in the province. In just a bit later, I'll explain more about how these clinics operate, but I thought to start with this visual to give a better idea of what goes into launching and operating a walk-in clinic that is led by a pharmacist. But why launch a pharmacist-led walk-in clinic in the first place? Well, anecdotally, if I were to speak with a fellow colleague of mine or even customers I've encountered so far, anytime I bring up how soon they'd be able to see their family doctor for whatever reason, but be it a follow-up or checking in for a different reason, I often hear one of two responses. The first one is, I won't be able to see them until next week or next month, if not later. Or the second one, I don't have a family doctor at all. The latter of which is becoming a growing issue. About 6 million Canadians, or approximately 15%, 1/5, of the national population, do not have a family doctor. These individuals resort to visiting either a walk-in clinic, which in a traditional sense is staffed by physicians, nurses, and other healthcare providers, or be admitted to the emergency room of the hospital whenever they require any medical attention. Add to that the individuals who, even if they do have a family doctor, they can't see them in a timely fashion. We reach the critical issue of patients waiting anywhere from 2 to 5 hours in the ER before being seen by a doctor. Similarly, in Ontario, wait times in physician walk-in clinics have more than doubled since last year. So quite honestly, it's an uphill battle between healthcare demand and healthcare supply. And as such, this has been an issue that's gained a lot of attention and interest among politicians and stakeholders alike, begging the question, what can we possibly do to alleviate the obvious stress on the healthcare system? This is where we consider tapping into the evolving scope of practice pharmacists have across the country and how we can play a role in alleviating the big stress bubble of our healthcare system. Since January 2023, pharmacists in Ontario were granted authorization to assess and prescribe for 13 minor ailments, covering treatment areas for allergies, eczema, bug bites, sprains, uncomplicated urinary tract infections, and conjunctivitis, just to name a few. Arguably one of the biggest scope domain changes to happen for pharmacists in the province. In October of that year, this number has increased to 19, and while by no means as comprehensive as the scope of practice across other Canadian provinces, like Alberta or Saskatchewan, this was one of the first major steps in allowing Ontario pharmacists to provide more meaningful patient outcomes and help chip away at the stress of our healthcare system. Many patients who entered a Rexall drugstore since the minor ailment scope expansion were able to get the care, guidance, and trusted advice from pharmacists they'd hoped for, and largely without any appointments. They simply walked right in. Now, with the recent announcements from the Ontario government that they're exploring further potential expansions in scope, pharmacists can potentially make even bigger contributions to patient care beyond our typical dispensary duties that we're all used to. But to make it really work, there would need to be some infrastructural changes to how a pharmacist can practice this growing clinical role inside a pharmacy. And this is where our pharmacist-led walk-in clinic model steps into the stage. Rexall's Pharmacist Care walk-in clinic introduces a new physical space coexisting within the drugstore right next to the dispensary. Typically, these spaces come with a dedicated clinic pharmacist such as myself and a dedicated assistant that we're calling a care concierge. The two of us worked in collaboration with the pharmacy team and the front store to promote the very same walk-in concept people got familiar with in the recent years when quickly visiting a pharmacy. Now, of course, people can book an appointment or phone us in advance or ask us any questions that way, but what we're truly embracing is the same fashion of walk-in service patients are used to when seeing a doctor or a nurse. But now they can do that with a pharmacist as well, while giving them a truly personable experience in a clinic setting, as opposed to having all our discussions across the pharmacy countertop. Every patient that comes in does so with a chief complaint or a reason to visit. And when this occurs, we're trained to engage in what we call our triage model of care. The first step is for us to determine whether the patient's problem can be fully managed by a pharmacist's intervention, recognizing the limits to our scope. Now, I do say the word limits, but realistically, because we label ourselves as a walk-in clinic, majority of the patients that are walking in are the same kind of patients a physician walk-in clinic would typically see. And a good portion of these patients can indeed be helped by a pharmacist alone, because we're able to do point-of-care testing, because we have certain prescribing rights, because we have the authority to provide certain immunizations, injections, and inhaled substances, and because we're able to renew, adapt, and review a patient's current medications in the context of their existing medical conditions. In cases where something falls outside of our scope, our clinic and the drugstore still provides additional options of care. First, there are plenty of over-the-counter treatment options patients may benefit from, even if it's not precisely prescribable. We could still guide them in their product selection and self-care management, which isn't that easy to do at a doctor's office if the products aren't there in front of you to grab, show, and tell. But moreover, our clinics come with the built-in capability to connect patients to a telehealth doctor right inside the drugstore. This is an immensely powerful addition to the walk-in clinic service because it allows us to provide so much more to the patient all in one place that just wasn't possible with our previous pharmacy infrastructure. And all of this are being led by pharmacists, which remains to be Canada's one of most accessible healthcare professionals. And finally, if the patient's visit truly cannot be solved by a pharmacist or through our telemedicine channels, then of course we would help the patient and tell them where they can go to get some help and refer them appropriately. And sometimes that's all what a patient really needs. Just to know where they can go, and we can help navigate them through their complicated and strained healthcare system. So the pharmacist-led clinics assume a big but honorable responsibility to help patients in more ways than a pharmacist could before. And there's been quite an impact so far. Rexall's first pharmacist-led clinic opened in Alberta in September 2023 and has now expanded to 4 locations in Alberta and 5 in Ontario, with more clinics launching in the country very, very soon. Since launch, our clinic network has seen more than 10,000 patients, and over 90% of those interactions were dealt with exclusively by a pharmacist. Keeping in mind, though, that currently our telemedicine service is only offered at our Ontario sites, given the nature of telemedicine support across different provinces. So that's 550 telemedicine-led consultations in just over half a year since Rexall launched its first pharmacist-led clinic in Ontario. All these numbers are based on the onus of each clinic keeping tallies of their interactions with patients, which isn't always possible to do with how busy we can get. But just to get a glimpse of the difference in care our walk-in clinics make, our data shows a 181% average increase in pharmacist-led professional services across all drugstores that comes equipped with these clinics, compared to when these stores did not have these clinics just about a year ago. More locally, our Barrie location, which is the first in Ontario that I helped launch in April 2024, saw a 317% increase in pharmacist-issued prescriptions, a near doubling of immunization and injection services, and a 53% increase in care plans and medication reviews, year to date versus the same time frame in the previous fiscal year. Every single statistic points to a much more profound involvement our Rexall clinic pharmacists have in patient care than before we've had these clinic pharmacists. It's a fantastic difference we've made so far. And the feedback we received have been amazing too. We've received several Google reviews across our clinic-equipped drugstores, with our ratings averaging above 4 out of 5 stars, speaking to the personable, quick, and timely service patients got from both the clinic pharmacists and our telemedicine partners. These reviews allow customers and prospective patients to see the feedback and make informed, confident decisions when choosing our pharmacies to fulfill their healthcare needs. So where do we go from here? As mentioned previously, there are currently 9 Rexall Pharmacist Care walk-in clinics, with plans to open several more in the near future. We're also hoping that, as pharmacists' scope of practice continue to expand, we'll be able to do even more for our patients in-house without the need to refer to another care provider. But when we do refer, they're to help patients navigate to specialist care more quickly and conveniently. And one of the ways we aim to accomplish this in the future is by nurturing our relationship with our telemedicine partners who are looking to refine their breadth of telehealth services with the potential to integrate them directly into the Rexall pharmacy ecosystem. I've spent a great deal of this presentation mainly in the context of Ontario's healthcare, simply because I myself work within Ontario's landscape. But of course, Rexall's strategy for the pharmacist-led clinics are to adapt with what's happening in each province. And as every province builds their own solutions to the growing healthcare needs of Canadians, we strive to deploy pharmacy-led clinics that can be part of that solution as well. We hope that stakeholders across the provinces will learn from one another to allow the pharmacists to do more in each of these provinces and incorporate them to our clinics as they launch there. So I hope you found this presentation insightful to the difference we've made and will continue to make for patients and their health. I invite you to learn more about our Pharmacist Care walk-in clinics by simply visiting the link on the slide or scanning the QR code, and that will take you to the Rexall website. And with that, I really thank you for your attention, and I hope you learned something new today. Thanks again.
Thank you so much, Roland. I know we had a question come in while you were speaking. I recall Caitlin had mentioned during her presentation they had an administrative assistant who helped book appointments and whatnot. There was a question that came in. I think it's for you specifically about whether or not triage. You talked a little bit about that check-in process
Yes.
occurs at the reception desk with an assistant, or is it a pharmacist who's doing that?
Good question. It's a hybrid. So what we try to accomplish with how we build these clinics is that it's not like the rooms are isolated and I'm being hidden away. I'm actually still in hybrid with the dispensary so that, if I'm busy with a patient at that moment, it'll be the assistant who will be helping out with the process. And if they're not too sure, they can always tap onto the pharmacist's shoulders and ask, hey, can you double check? So it's not exclusively dealt with by the pharmacist for triage or the assistant. It's both. But as we are rolling these out and providing further training, we're hoping it's the assistants who will mainly be leading it, but it can always do a double check with the pharmacist on duty.
Awesome. Thanks, Roland. I don't see any other questions, but as Linda mentioned at the start, for those who might have joined us a little bit later, we will have time for a discussion with the panel at the end of all three presenters. So maybe with that, thank you so much, Roland, for your presentation. It sounds like these clinics have been really well received by communities and much needed as well. And I enjoyed learning about how you've incorporated that full scope into your practice, but also thought about how you can fill those gaps through telemedicine, which was neat to learn about. So hopefully we'll continue to see expansion for pharmacy services that can be offered in Ontario in the coming future.
Thank you.
Okay, our last speaker of the day is Amani Chehadi. Amani graduated as a pharmacist from Beirut Arab University, and she began her career actually with GlaxoSmithKline, and then became the owner of a pharmacy in Beirut in 2003. In 2006, Amani immigrated to Canada, and after earning her Canadian pharmacy license, joined Calgary Co-op as a pharmacist and later transitioned to Shoppers Drug Mart. Here, she's grown her career and now owns multiple Shoppers Drug Mart pharmacy locations. And a year ago, she opened a pharmacist-led clinic at one of those locations where they focus on helping patients manage chronic conditions, address minor ailments, access travel and routine vaccinations, and they also offer heart health screenings, diabetes care, and weight management services. When she's not busy doing this, Amani is a mentor to internationally trained pharmacists and provides career opportunities for newcomers, including Syrian and Ukrainian refugees. She was a two-time finalist for Shoppers Drug Mart Associate of the Year and has also served as a speaker at the first Arab Summit in North America. So please join me in welcoming Amani.
Hello again. Thank you so much for your introduction. I'm Amani Chehadi, as you said, associate owner for 2 stores in Calgary, Alberta, the Shoppers Drug Mart 2449 Aspen Landing and the Glendale location 345. I'm happy to be part of this webinar today, and I hope that you can get the best out of it. I'm just going to share my screen right now. Okay. So today I'm going to talk about the pharmacist-led clinic that we opened in 2023 in November at the Glendale location, and it's actually like one of the many pharmacist-led clinics that opened by Shoppers Drug Mart for the past year, and we're aiming to be opening by 2025 around 250 locations. So the main thing about the pharmacist-led clinic is the trust that we get from our patients, and it encourages us to open more clinics. So Shoppers Drug Mart pharmacies are dedicated to enhancing the health and well-being of their communities by offering a comprehensive range of clinical services to our patients with a focus on personalized care. These pharmacist-led clinics serve as accessible healthcare destination, providing patients with expert advice and support. As we all know, lots of Canadian or Albertans, they are missing a family doctor, or they come from as refugees, or they come as immigrants and they don't speak the language, or they don't have a family doctor. So the presence of us as the pharmacists with expanded scope of practice and the pharmacist-led clinics helps a lot these people to get the support and the advice they need from the healthcare system that they are missing from the healthcare system. Through professional pharmacists and healthcare team, we as Shoppers Drug Mart ensure that individuals receive the necessary tools and guidance to manage their health effectively. The services we provide is to cater various healthcare needs, from preventative care to ongoing disease management, all delivered with a commitment to patient care and convenience. In Canada, patients place a high level of trust in clinical services provided by us as pharmacists, recognizing us as accessible and knowledgeable healthcare professionals. And as accessible, we mean by opening hours, like we are open from 8 to 12 midnight. So I had so much experiences with patients coming to pharmacies at 10 p.m. asking for a pink eye treatment or UTI. They cannot sleep. They are bothered by the condition. They can't go to emergency room. They have to wait till the morning. So they come to us, and then we help them by providing the prescription or the support they need or the consultation they need to be able to manage their condition. And there is a survey that's about the trust, how much people trust in pharmacists in Canada. And notable results from this year's surveys include 93% believe pharmacists play an essential role in healthcare system. 90% trust pharmacists to provide healthy lifestyle changes. 90% trust pharmacists to provide management of chronic health conditions. 96% trust pharmacists to provide advice on medicine. 87% trust pharmacists to provide vaccination. 93% have a positive impression of pharmacists more than doctor, teachers, military officers, or police officers. The clinical services that we provide through the pharmacist-led clinic and through our pharmacies are, first of all and foremost, is prescription dispensing, medication reviews and management, diabetes management, immunization, chronic disease management, health consultations, smoking cessation supports, and blood pressure monitoring. In addition to many conditions that we take care of, which is the hemorrhoids, UTIs, allergies, birth control, shingles, ringworms, and many others, cold sores treatments, acid reflux, acne, all these kind of things that we provide as a pharmacist by doing by the expanded scope of practice we got by prescribing for these or minor ailments. And the main thing that I would like to talk about today is the heart health screening. This is an initiative done by Shoppers Drug Mart to support the patients and make sure that we're screening for heart health conditions. And this heart health screening assessment helps patients find out if they might have diabetes, high blood pressure, or high cholesterol. So it only requires it's very simple, like heart health screening that we do through our pharmacy-led clinics. It only requires 2 quick finger pick tests. It's free. We don't charge for it. The result will be ready in only a few minutes. And we identify eligible patients through our criteria: over 40 years old, does not have diabetes, and no A1C testing in the last 6 months. The test involved is BMI test. We check the weight, which is healthy for whatever the healthy weight is for your height. Blood pressure test, we assess for normal blood pressure. A1C testing to measure the average blood sugar level over the past 2 to 3 months to help the pharmacist assess for pre-diabetes or diabetes. Lipid and cholesterol test. This blood sample will be used to measure your cholesterol level, including HDL, LDL, and the triglycerides. Why this program is important, the one that we're doing at our pharmacy-led clinics, is to give a clear picture of our current health, of the patient's current health status, early identification of any risk factors, and working together to create a plan to manage the health of the patient effectively. What happens during the appointment when the patient comes for the heart health screening? If your test indicates your blood sugars are high or that you are at risk of prediabetes or diabetes, we will discuss the results and we will suggest what's the next step. We'll provide ongoing support, including a follow-up appointment and connecting with the family physician to help the patient manage the identified condition. Then in the follow-up, we will decide if the patient needs a follow-up based on the test. The tests show they may have diabetes or prediabetes, high cholesterol, or high blood pressure. And based on my experience with the heart health screening program that we did through our pharmacist-led clinics, we identified many patients that they have history in their family for strokes, and they don't even know, they don't test their blood pressure on a regular basis. And when we did the heart health screening for them, their diastolic blood pressure was high. They have a family history of stroke. Their weight is high, and they didn't even think about any risk factors for their condition. So that's why I felt like really encouraged to work with this program and passionate about supporting our patients in Alberta with this heart health screening program. Just gonna escape, go back here, sorry. Yes. So yeah, so like as a pharmacist here and as the pharmacist in a pharmacy-led clinic, we really feel passionate about what we're doing, and we really encourage all the pharmacists to kind of go within the expanded scope of practice and do whatever is supposed for us to do to show how much we're able to support our patients here in Alberta and Canada in general. And thank you so much.
Thank you, Amani. If I can get you to stop sharing your video, that's awesome. Thank you so much. That was a really great presentation. I know there have been a lot of pharmacists who have sort of looked to Alberta over the years as the North Star on scope. So it was really great to hear what you've been able to accomplish with that in your practice there. I see there's quite a few questions that have been coming in through the Q&A. Thank you so much for sending those in. I think some of them may have been for Roland and some of them for Amani. Maybe at this time, since you are our last presenter, I'll ask for all our panelists to come back on the screen, and then we can get to some of those questions with all of you on. I'll start from the top there on the questions, if we don't mind. I think the first ones might be for you, Roland. There's some questions that are coming in on telemedicine. Looking for some recommendations for independent stores. It sounds like there maybe are some pharmacies who have explored that option with some of the larger providers and found that they're running into some challenges with being able to find a telemedicine provider. So I was wondering if maybe you wanted to speak to that a little bit.
Sure. Yeah. Obviously, because I'm more in the front end things of pharmacy, it's hard for me to gauge where those relationships are being built. Obviously, I can imagine that for smaller independent pharmacies, a lot more self-gauging, exploring they have to do. From my own personal explorations of just gauging the landscape when exploring other pharmacies in the community that do offer it, one of the companies that did show up was something called MD Connected. I don't know how they are in terms of expanding into other things, but that could be a potential option. Otherwise, when it comes to building those relationships, I think it comes down to searching the options that are available online and speaking to their teams to see how they can foster or start a relationship. And I think we can go from there.
That's great. Thanks, Roland. And one other sort of maybe follow-up question on telemedicine as well. Maybe with your experience with your current telemedicine provider, then is it general practice, or do they also have the ability to offer like specialty services as well?
Yes to both. So most patients are coming in will likely be coming in for reasons where it's like a general walk-in thing, could be like an upper respiratory tract infection, which given this respiratory season, that number is going to probably be going up and up as we go through the holidays and everything. But there are also people who are coming in for a referral, like they come to a walk-in because they want to get a referral to a dermatologist or a gynecologist or a psychiatric specialist. And the team that we're working with, our telemedicine team, is able to make those referrals, as well as they're also, I believe, trying to enroll into their roster specialists who can help them out as well. So the goal is one of the things we're actually looking for. Our future landscape is about that, more convenient referral system, is to be able to have a patient come to the pharmacy and get that referral started much quicker. And because I believe those interactions can also be done through the telehealth platform, which can come to become very convenient and more efficient, especially if people are looking for a specialist. So to answer the question, it's both for general practice and for specialist care, both now as a referral system and down the road more efficiently. We're trying to get specialists quicker.
Very neat. Thank you, Roland. The next question is actually about triage. So I know both Caitlin and yourself talked a little bit about your triage process. Maybe we can start with Caitlin. The question is, how do you address privacy at triage?
The way our pharmacy is set up, I could probably bring up the image again, but we do have a lot of privacy windows so that if a patient has a specific question in the dispensary part, we can speak to them privately. Either we have some private counseling rooms, we have the privacy windows. Also, our clinic is separate from the dispensary, so there's a separate entrance. So when patients come in through the clinic entryway, they're met with our clinic administrator first. So the privacy is there as well. And over the phone, obviously, it's private, and our clinic administrator or our pharmacy assistants, technicians, pharmacists are helping to triage as well.
Thanks, Caitlin. Anything to add to that, Roland? Similar?
Yeah. So as I mentioned in my presentation, our pharmacy-led clinics are very much well integrated to the whole dispensary, right? It's kind of all very well connected. So the way that we've established privacy is through our infrastructure. First, we do have the actual acrylic separators across our whole countertop that separates both check-in and check-out or pick up prescriptions. That can help generate some visual and acoustic privacy because the way they're formatted. But if there's something that just by gauging with the patient, discussing with them, we can tell that there might be some discomfort, nothing stops us from asking the patient, would you like to speak about this in a more private area? Because our care and assessment rooms, the two rooms that are all connected to each other, can have that full room of privacy. We close off the doors. We can discuss that triaging there because, again, nothing is stopping me or an assistant to use those rooms if they're open to, and then we can always bring them back to fill up any paperwork. So we achieve the privacy quite easily because we always have now that space to do it.
Okay, awesome. Thanks, Roland. And then maybe a question that builds on this idea of triage and then what happens after triage. There's a question about what you do with that patient who books an appointment for something that's out of scope for the pharmacist to prescribe, assuming it's not caught at triage. How do you handle those? Because I assume as patients see this concept of like a walking clinic or a pharmacist clinic, you may see some out of scope things. So maybe, I don't know if we want to start with, if anyone wants to jump in on that one. Maybe Amani, if you want to share some thoughts about.
So we had situations when we had out of scope conditions, and it is very like simple. Like if we don't like it depends also on the expertise of the pharmacist who's taking care of the situation. If like some people they are more confident about diabetes than others, or about like blood pressure than others. So it depends on how comfortable you are, and at the same time, if something is a red flag or we need more assessment or consultation or like collaboration with a family physician, we do refer them to a family physician. We just stop and then tell them, you know what, in this situation, we need you to see your family physician, and then we refer to a family physician. We can either contact their doctor like ourselves if the situation is critical, or like we can send them to emergency room, or at the same time we can manage what we can manage at the spot and then refer them to their family physician, or help them like we in our location we have a walk-in clinic by our side as well, and we have good relationship with the doctors. If we find that the situation needs like direct attention, we talk to the clinic and we refer the patient to them.
Thanks. Anything to add to that, Caitlin or Roland?
A very similar concept here. If it's outside of our scope, we're referring. We do not have any walk-in clinics in my community, which adds a little bit of an extra challenge, but we do have a couple different opportunities. We have a nurse practitioner physician-led primary care clinic, but referrals are required, and it is one of the referrals that pharmacists can do here. So we're often writing referrals to that primary care clinic for chronic disease management for patients that are outside of our scope of practice. We have mobile primary care clinics, which they kind of do pop-ups in the community once a week. And then they just recently opened like a non-urgent type clinic that is also appointment-based. So patients call in the morning, and it is difficult for patients to get appointment times, but those are who we're generally referring to.
And Roland, also similar, you'd say?
It'll be very similar. So first things first, because people are coming into the pharmacy or pharmacy-led clinic with that interest in mind, we do first and foremost thank them for their time, for choosing us and considering us. We do let them know what our current limitations are and that those limits will change with time. And then we'll immediately start, again, gauging upon what their chief complaint is, determine the urgency of the situation. It's just like a typical triage would, let's say in the hospital, what nurses do. So if it's something that we think can be managed within days time frame, then we would ask if they're able to we will tell them some other walk-in clinics nearby that they can explore, and with the maybe physician led that might be able to take them in by as a walk-in visit, or if they do have a family doctor, then if they're able to see them in a bit of a within that time frame. If we assess that that situation may be a bit more urgent, is something that should be seen within 24 or 48 hours, then we will let them know where the nearest hospital would be or any urgent care center if available in the area. So we're not shy of telling them what we are and are not able to do and where they can go for help, and understanding that patients may have wanted to come here. We appreciate that, but if they do need to be seen by someone else, we'll let them know where they can go.
Thanks. Thank you for that. Maybe I want to make sure we can get through all these questions. We'll shift gears a little bit because there are some questions coming in around like the cost and financial sustainability. This one is maybe for Amani. You talked a bit about that that testing service that you offer, and there's a participant wondering how you cover the cost of testing, especially for the heart health.
Okay, so for the heart health screening, it is something supported by Shoppers Drug Mart. So we do it through our like the head office support. And in some situations, when the patient is not eligible for the health screening and they want still to do the A1C testing or the lipid testing, there is charge for that. But if they are eligible for the heart health screening, we don't charge them.
Okay, I see. Neat. And then I guess for all the presenters then, there is a question about whether or not your clinic models are currently financially sustainable with the existing funding and clinical frameworks that each of your provinces have. So I know that's a big question to tackle and maybe not one that you might be able to fully answer, but if we want to start with, maybe we'll go east to west.
I can start if you want me to. I'm not, our CFO is usually the one that's handling that side, so I'm not as privy to that information, but what I can comment is we're kind of breaking even from the last I checked. So we're able to support the team members working in the clinic, and that is about the extent of it. It's definitely not a large profit.
And maybe Roland.
From my side, talking on my behalf, like I think we don't want to look at the short-term goal from the pharmacy care clinics. We're looking into long-term goal and how much help for our community and our patients. And by supporting our community and helping the healthcare system, I think, and showing how much important these pharmacy care clinics will probably get the funding and from the government that is a necessity to operate and continue with these pharmacy care clinic. But our main focus is the patient health care and supporting our patients and our community. As a pharmacist, this is like mainly our passion and our goal in supporting the communities that we help.
Mm-hmm. That's a great answer. I really love that like it's it brings us back to who we are as pharmacists.
Yes.
Which is really nice. Roland, anything to add to that?
Amani has said it really well. It all comes down to making a difference for patients. And as Keelan mentioned, I'm not really involved all too much in the financials. But what I do know as well is that the goal at the very least is to make sure we're breaking even so to stay sustainable. And from what I've seen with how our clinics are growing and continue to grow, that goal is being achieved at the very least. And I'm sure there's more, but I mean, I don't have all that financial visibility. But at the end of the day, it also helped to make a statement that, government stakeholders, politicians can see that people are coming to the pharmacies for help because we are so accessible and our scope is expanding. And it speaks to the fact that we have a good, sufficient level of training to be able to take on more responsibilities and collaborate with our healthcare system, with our physicians, with our nurses, so we can do more. And as the scope expansion occurs, it's going to help provide more funding, both in the provincial and or private sectors, so we can be able to do more. So so it is a long-term goal. As Amani mentioned, same thing for us as well. What we can do now is to help us be able to do more for the future.
Amazing. Do you think you can share approximately how many patients, like on average, you see per day, maybe for all of you?
You are very. I'm about 20 to 25, depending on the length of our visits. But I just did a quick look at the rest of our week, and we're about 22, 23 for the rest of the week booked so far.
Wow. And is that one pharmacist for like an 8-hour shift?
Yeah. So we have one pharmacist in there from 9 till 5, booked 9 to 5. Obviously, if there's no patients booked after like 4:30, we'll go home. But yeah.
Very nice. And Amani?
Yeah, we see it's variable as well for us, like between 15 to 20 as well. Mainly, like we see more during the weekends when the walk-in clinic beside us and the family doctor clinic beside us is closed. So we see more patients during that time, and yeah, around like 15 to 20, maybe sometimes 30, based on how busy like the day is, and if it is like a cold season, or if there is something going around in the area as well.
Nice. And that's also like a one shift, 8-hour shift.
8 hours shift, yes. Yeah.
Okay. Awesome. And
And in
Roland,
addition, as like we open again, like from 8 till 12 midnight, and the pharmacist on duty, if the care clinic is not, if there is no pharmacist at the care clinic, the pharmacist on duty, they have also expanded scope of practice. They do prescribing, they have an APA, so they can still help with the patients coming outside the clinic hours.
mhm. Yeah, that's the real convenience part about
Exactly, yeah.
pharmacy. Yeah. Roland, average patients.
We're looking at around 10 to 20 right now, and this again is excluding the current the current influx because of flu and COVID season. So about 10 to 20, and that's to cover everything between minor ailments, medication consultations, and telemedicine as well. That's just to take it all together. And again, as you've asked before, within an 8-hour shift.
Okay, very cool. This question I think is really interesting. We didn't touch on it yet, but we know they play such a big role in our practices. Have any of you incorporated a regulated pharmacy technician into your clinics? And if so, in what capacity, and how has that changed your dispensary workflow?
Yeah, I have 3 regulated pharmacy technicians in my practice, and it plays an important role for us actually. They help with verification and they help with product check. And if the pharmacists are busy doing injections during now the flu season, and there is the verifications needs to be done like during the regular flow of the pharmacy, the regulated technicians help a lot by helping with verification, helping with product check, and directing patients for the regulated pharmacist, for the pharmacist on duty.
Similar for us as well. I have 3 registered technicians who are doing clinical checks and triage and managing billing. And we're hoping to integrate them more specifically with our clinic. We're hiring a few more. I'd like to see them doing more reviews of patients' medications and having all of that in a chart before we get to the consult to save time. So maybe down the road, having them get relevant information like blood pressure, having that ready for us prior to starting the appointment, having your full file updated, allergies, medical conditions, prescriptions, over-the-counter products, a med rec basically before the appointment. Haven't started that yet, but that's what we're hoping for.
For us, we have one site, I believe, that has taken on a regulated pharmacy technician to be as the care concierge. But I believe most of the sites are using assistants. The difference I've heard from the store that has it is that because they're so well understanding of what their scope is and the scope of the pharmacist, they're really tap into our abilities and are able to promote the services very well and make the patients aware of the services, because they're not only helping on the clinics end, because they're working in our check-in, they're also helping for the pharmacy dispensary. So sometimes they'll just engage with the patients and let them know if they're, based on the context of their profile, they will speak with the patients if they're interested to do any such services, and they're able to catch that opportunity very quick, very well, which is great because a lot of patients sometimes just do not know what a pharmacy can offer beyond a dispensary. So that ability to tap on the technician and use their abilities is quite promising.
Awesome. Yeah, we hear so much about the value of that pharmacy technician from a lot of our members as well, and the opportunity to tap into that capacity more and more as the profession evolves over time. So thank you for all of your answers. While we're talking about the role of different providers or members of the team, we had one question come in specifically about internationally trained pharmacists. So I was thinking, Amani, with your journey as an international graduate, if you wanted to talk a little bit about what you think the role of an internationally trained pharmacist can be when they're working as an assistant in a clinical practice setting. So I think maybe before they have their full license to practice as a pharmacist, do you see the role of that individual any differently?
The thing is, with the international trained pharmacist, I've been working like for the past 10 years with lots of them. Like they come to me because I am an international pharmacist, so I have the experience, I know how the process and all that stuff. And they do very well as an assistant because it's easy for them to train on medication, what's the name of the medication, generic name, all these kind of things. So they were like when we integrate them into our pharmacy, so they get like they get the knowledge really quick because of their knowledge and their background. So they help us even with consultations. Like then if like a patient needs a consultation, they know where to which one to refer to a pharmacist and which one they can help as an OTC because of their background. So they know like if it is something that needs a pharmacist for consultation, they will send it to us. And at the same time, as I said, because of their experience, they are easy to learn, and we help them with their exams, like to practice for the PEPC and for the OSCE and for the MCQ. So it makes it easy for them once they are in a Canadian setting. It makes it more easy for them to pass these exams like faster and to get the experience, the Canadian experience. And as I said, like most of them, and in addition for being international, like they have the language. So if we have customers that they speak their language, it's easy for them to do medication reviews or to counsel or help us in consultation for patients who have difficulty in understanding the language, the English language.
That's great. Thanks, Amani. And it's really nice to be able to have your experience and background here to be able to share the benefit and value that these international pharmacy grads bring to the profession. While we're sort of talking about the triage and how things are set up, I think we have one last question here on a workflow. What type of forms do you have patients fill out before seeing the pharmacist for these clinics? Who wants to start us off on that one?
I can start actually. Like we have a standard form that the care concierge give to the patient while waiting for their appointment. So they fill the form, which includes their name, their medical history, their allergies, their family doctor, which is the regular like form with weight, height, smoking history, all that kind of things, family history. So it's kind of like more. It gives us more kind of background of the patient when they are coming to the consultation room. So we know if they have smoking history, or if they drink alcohol, or how much the weight, so that we don't need to ask the question again, and it will help us with our consultation and prescribing.
Maybe Roland, I think I saw you trying to jump in there.
Yeah, we have a very similar standardized form that we're giving out. And also if it comes to, for example, let's say it's a child that's coming in or someone that's under the age of 18 that's being accompanied by a parent, we might take both their informations in. Just first off, it helps to roster them into our system. But second off, it also helps to make sure that we capture any appropriate consents needed. If there's something that, let's say, it's not really within the pharmacist scope because of the age restrictions, but something that maybe telemedicine can help with, they do ask sometimes for a parent or guardian's permission. But our form is also standardized as it is, as Amani mentioned. It is to capture all the information, but it's to keep nice, short, and sweet because we want to be able to get engaged with the patient and have a conversation, consultation with them. So we try to keep it nice and simple so they can start with us quicker.
That makes sense. And Caitlin?
Yeah, similar concept. Depends on the type of appointment, like vaccines or travel consults, or we also do, because we're still a pilot project and a lot of information, we have a consent form for our patients to sign just so we can use what types of appointment that they're being provided, how long the appointment time takes, any referrals, how many prescriptions are renewed, that kind of thing, was all information that's going into this pilot project. So there was a consent form, is a consent form for most of our patients to sign when they first have an appointment with our clinic. And now that we work with nurse practitioners, a consent to communicate about their personal health information with a nurse practitioner if required.
Interesting. Yeah, it's neat to hear the difference between the need for like that consent piece because it's a pilot project versus some of the other clinics with Roland and Amani. So thanks for that. I think we have time for one last question. This is a look to the future type question, so a perfect way to end, I think. What types of funding so the service fees or expansions in pharmacist scope are you hoping for in the future that would help support this type of clinic work? And I know there's a few differences across the provinces that you each work in. So maybe we'll go west to east coast. Since we had the speakers go east to west, we'll start with Amani.
So the question regarding is funding, you mean?
Like, are there any additional funding that you think would help support the clinic, or any additional scope that would help support the work that you do in your clinic?
You know what? When I came from Lebanon in 2006 to Canada, we in Lebanon used to prescribe, used to do injections at that time. And when I came here, I was like kind of surprised that we don't, do here in Canada. And then with the expanded scope of practice, I was very excited to start doing injections in the pharmacy. And later on, we became prescribers, like in the pharmacy as well. So, and I felt like how much it helped the community. Like now I feel like, because I used to feel myself when I was back in Lebanon as the family doctor of the neighborhood. So they all come to us for prescribing and for injections. So now I feel the same feeling that when I'm in my area, like in Aspen or in Glendale, that we represent so much importance for our community, that they can come to us for cold sores, for minor burns, for strep throat testing, all these kind of things. So we are so much passionate about what we can do now and how much we're helping our community. And I think definitely by reducing the emergency visits, by helping our customers manage their chronic condition, if it is diabetes and complications, because I had so much customers coming with injuries in their legs and they are diabetic, and some of them lost their feet or lost a toe or something, and they didn't know what to do, because they didn't have someone to tell them about the diabetes care, how to take care of their foot care and all that stuff. So we feel we are doing so much for our community and for the healthcare system. So based on how much we're saving on emergency visits and how much we're saving on clinical condition management, I think we need a better funding for the clinical services and the pharmacy-led clinics that we are now operating.
Thank you for that. Roland, I know in Ontario we're not quite at the same level of scope as Amani has there in Alberta. Thoughts on additional expansions that would really benefit your clinic, and also funding?
Yeah, our scope is far from what the other provinces have the privilege to have. So that'll be amazing if we can add it. One of the most often requested treatment areas that right now where our hands are really tied is in group A strep, or sore throat or strep throat testing. It's very much a gray area where it's, you can order the rapid test to swab for sore throat, but we cannot do it as pharmacists. It's not technically something that's in our scope, although it's not any more difficult, for instance, than doing the rapid test for COVID, but for some reason we're not able to do it. So that is so minor ailment expansion is definitely something we're looking forward to, because if you think about it, what our treatment areas currently cover, maybe about 40 to 60% of what's already available as self-care selection over the counter. So more ear, eyes, nose, throat for sure, because people like to come in with those things, and half the time those things are very limited to either what is within a minor ailment scope, like conjunctivitis, or what is some over the counter as an initial treatment step before they're actually able to see someone who can help with that, as well as funding and a scope expansion for more point of care testing to provide them for more things. I know that currently the two major ones in Ontario are for lipid panel and A1C, but that's just scratching the surface. Of course, there's people who are doing routine testing for things like hypothyroidism or thyroid stimulating hormone. I don't know if there's any POCT technology for that just yet, but of course that's going to be both a technological piece to expand on, and hopefully then maybe more things that the government can allow for sure. And overall, also just reflecting the demand of pharmacists for care from the public, because they're coming to us as a source of care, as a new point of primary care more and more. It's also reflecting the funding model itself. I think there's a lot more work that needs to be done to acknowledge that we are doing a lot now for patients than before, and making those numbers reflective of both the patient demand and naturally the inflation of the currency.
Agreed on so many points. Thank you for that, Roland. And Caitlin, you, I think maybe in Nova Scotia or somewhere in the middle there, you've got a more expansive minor ailments list than we do in Ontario, and you've gotten into a bit of that chronic disease management. Thoughts on continued expansion and funding in Nova Scotia?
I know our team would really enjoy to have an expansion in referrals, being able to refer to different healthcare providers. I think I have a lot of patients asking for gout treatment and assessments. That's a very popular one. We've taught our government, and our scope of practice has grown exponentially over the course of even the project, and the ability to diagnose hypertension and diabetes has been huge. Ear infections, that's made a huge difference. So our government's been quite responsive to the needs of the clinic so far in the project. So I only hope that they continue to work with us. They've improved their funding for a few services, so I can only hope that that continues. And as we see the different needs of the patients change and discuss that they'll follow suit. But maybe some obesity management, that's definitely a growing concern in our area. So those types of things, but very similar to what the others have said.
Awesome. Thank you, Caitlin. And thank you to all three of you for the work that you've been doing in expanding the role in primary care for pharmacists and showing what is possible in each of your respective provinces. I think we're almost right at time, so I'll hand it back to Linda to close us out. Thank you.
Thank you guys for a very, very informative and it was a wonderful, wonderful presentation. If you guys want to learn more, the fall issue of the pharmacy, Changing Face of Pharmacy is coming out hopefully when the strike is over in the next issue of Pharmacy Practice. If there is still a strike, it will be available online as a download next week so that you can download and see it. So you'll hear a lot more about these three pharmacists that we've highlighted today, as well as get an updated on our pharmacy services chart, all updated for this year. So just before we leave, once again, I want to thank our sponsors for making today's event possible. I'd like to thank Amgen as our platinum sponsor, GSK, and Shoppers Drug Mart Loblaws, and our gold sponsors, AbbVie, AstraZeneca, and Pfizer. You can always stay in touch with us by reaching us at, waiting for the slide to come up, there we go, cfpnet.ca on our website. So this is our last forum for this year. I want to thank you all for joining us. I am open to suggestions for next spring and next fall. So if you guys have any areas of interest that you would like us to cover, please feel free to, you can go on the website and get my contact information and send me a quick note. And I look forward to seeing you all in the spring. Happy holidays, everybody. Thank you.